Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
What are your thoughts about a mask mandate at this point?
I think it's necessary. We're going in the wrong direction. We're sliding into the wrong direction, let's put it that way. And we're still having some 63,000 new cases per day, where this is not control. Now, the problem when there's this much virus out there in the community, even if you're vaccinated, you're still at some risk, 5 or 10% risk. You know, nothing is 100%. So this is not going in the right direction. Masks and social distancing will get rid of that.
So we hear about rare reactions to these vaccines. There were some scary pictures of a guy, I think, who had the Johnson & Johnson vaccine, this horrible rash. Talk about this.
Yeah, I mean, that's a terrible, terrible reaction. That person ended up in the hospital for 5 days. Think of how many millions of doses we've been giving out. So this is a very, very rare side effect, probably to some ingredient in the vaccine itself. We'll never figure it out, but terrible, terrible reaction.
So when you see stuff like that, does that mean you should avoid one vaccine over the other, or is this something that should not worry the average person?
No, you're talking about something happening on the order of like 1 in a million.
Okay.
Or less. So, you know, you're never going to figure out, you know, who's at risk for what. And, you know, we still have anaphylaxis from the Moderna and Pfizer ones. You have this bad reaction from the Johnson & Johnson, but it's at such a low level, you won't be able to figure that out.
Let me follow up on the question I asked yesterday about the WHO report. I heard a scientist on the radio say that the idea of it coming from frozen food is absurd, knowing what we know about COVID. But he says the report seems to be running away from the lab. He says it absolutely did not happen on purpose, but he said lab accidents happen all the time. Should they be looking closer at that?
Well, first of all, lab accidents don't happen all the time. Laboratories are certified, the people are trained. You know, it's not just common to get a lab accident and to have somebody in the lab get in a highly contagious infection that they're working with in the laboratory. You would hear about that. Mm-hmm. That's like big news. When was the last time you heard someone in a lab got, you know, Ebola or, you know, Lassa fever or something they're working with in one of these highly restricted labs? You know, it's not a common thing to happen.
Okay, let's get to some viewer questions if we could. This person says, I've had both shots. Last week I was at a person's house that tested positive, that then tested positive. Am I a carrier?
No, no, probably not. It's probably completely unrelated. You know, the one thing is that even though you've been vaccinated, you have a 5 or 10% chance of getting it, and you would probably have a very mild disease. That's true. But, you know, this person is not a carrier. Okay. We don't even know anybody in a carrier state with this disease.
Next viewer question, if all people are fully vaccinated, is there a limit you recommend for how many should gather? We're thinking about a Mother's Day weekend outdoor picnic, no sharing food.
There's a yes and no. If everybody's vaccinated, your risk is very low. The only risk is this 5 or 10% that can get the infection even if you're vaccinated. Now, unfortunately, in the United States, we still get 63,000 new cases per day. You know, this is not good. So, you know, so the smaller the gathering, the better. But there's no like cutoff. You know, if everyone is just sort of careful, they're all vaccinated. I don't think they have to wear masks. I think you can just be prudent and try, you know, not being absolutely too close, like try to stay 3 feet away. All
right, last question. My nearly 18-year-old grandson is on a heavy vitamin for his acne. Can he still get the shot when it's available?
Yeah, he's on heavy doses of vitamin A for his acne, which is good for people with bad acne. I have not seen any contraindication to vitamin A and the vaccine.
All right, Dr. Murphy, good to see you again. Thanks again for joining us. If you have a question for the doctor, you can post it on our Morning News Facebook page. And we'll talk to him again tomorrow at this time.
Thanks, doctor.
All right, have a good day.
You too.